education, protocols are just of the highest standard. So thank you
Thank
very
you.
much. Thank you.
Thank you for these beautiful words. No, but it's beautiful for us to see that we can do something good for the people all over the world, and it's really the motivation, the strongest motivation we have. Okay, please jump on your syllabus to page 50, because I want to share with you some protocols based on our research. And if you agree, we can start with how to approach with low-dose medicine, IBDs. But in general, different inflammatory pathologies of the gut mucosa. For us, in low-dose medicine, in physiological regulating medicine, it's very important the role played by the gut in controlling the systems. I think that the gut is really a PNEI microcosm. Just think that the gut is able to produce neurohormones, cytokines, neuropeptides. So a disruption in the physiology of the gut has reflections on in all the systems. In inflammatory bowel diseases, our strategy is to act on 3 different points that are the microbiota, the gut mucosa, and the immune system. And I don't know which is controlling the other one. They are absolutely interconnected. I start just sharing with you some possibilities to restore the homeostasis of the microbiota. Just to have an idea, I told you that in our body we have 40,000 billion cells. For each of our cells we have 2.7 bacteria. So they are much more than our cells. 2.5 kilograms of bacteria in our body and 1.6 kilograms in our gut. And sometimes I ask myself, we host the bacteria or do the bacteria host us? And I think that they host us. And they are even in control of our behavior. Everybody knows the connection between brain and gut, the so famous gut-brain axis. And it's bidirectional control. I mean, stress can alterate the microbiome homeostasis. An alterated microbiome is able to control behaviors. Just think that 90% of serotonin is produced by enterochromaffin cells in the stomach and in the gut. So it's typical, we are under stress, low serotonin. If our gut doesn't work well, we are not in a good mood. The bacteria of microbiome control inflammatory processes in the gut. I mean, if we have an homeostasis among pathogens and symbiont bacteria, we have a control of physiological inflammatory processes in the gut mucosa. If, for instance, stress or food or drug disrupt the homeostasis among the 10,000 different species of bacteria, they, instead of to control physiological inflammatory processes in the gut mucosa, start a pathological inflammatory process. So take care of your microbiota. I think it's wrong to destroy, for instance, to destroy bacteria with antibiotics, the triple therapy for Helicobacter pylori, but it's also wrong to insert bacteria with every probiotics possible. I think that the most modern approach is to select the microbiome, and we can do something that, in that case. Just a curiosity for you. Pediatrics 2013 published a paper, this is amazing, published a paper about the possibility that a couple of years ago in the United States we were discussing on the use of the triple antibiotic therapy to eradicate Helicobacter pylori in children under 3 years old. It's crazy, okay? And the title of this paper in pediatrics was, "Are we building a generation of obese people?" Why? Look how important it is to preserve the microbiome. We have a mutual relationship between some hormones that are leptin and ghrelin in controlling appetite. Leptin, you remember very well, stimulates the center of satiety at the level of hypothalamus. Ghrelin stimulates the center of appetite. So we can consider leptin and ghrelin as opposing antagonistic hormone. Physiologically, ghrelin goes down after the meal. Otherwise, it continues pushing the center of appetite. Do you know which is the bacteria able to down-regulate ghrelin after meal? Helicobacter pylori. So, if in children below 3 years we destroy completely with the triple antibiotic therapy HP is not more able to downregulate ghrelin, and ghrelin will stay very high even after meal, pushing the center of appetite. The title, "Are we building a generation of obese people?" Yes. Thanks God they didn't approve the triple therapy, antibiotic therapy to eradicate the HP. Just to understand how delicate is the homeostasis among the 10,000 different species of bacteria in our microbiota. But we don't respect the microbiota. For instance, stress, lifestyle, alterate the microbiome. Drugs, antibiotics, but also NSAIDs. Food alterate the microbiome. Not organic food does that. And look, I don't know if you know these pictures. This is nice. They are not scientific, and so I cannot tell you this is something in a peer-reviewed magazine, but it's nice. These are two corns, GMO and organic. If I ask you, as scientist, which would you eat, the left one or the right one? Obviously, the right one, because you read the New England Journal of Medicine or the Lancet. But if I ask birds what you would eat, look, to preserve the species, they eat the organic one, not the GMO. Why? Because, for instance, engineered food in general alterate the homeostasis of the microbiota, and instead of to have this balance, we have more pathogens that start inflammatory processes. I mean, a good microbiome control your physiological inflammation at the level of the gut mucosa that we need to have the immune tolerance. If you disrupt this homeostasis, start the inflammatory processes, especially with high level of TNF-alpha, and you have colitis and so on. So first, preserve the microbiome. This is just to smile, but this is a very important magazine, Journal of Organic Systems. They are 4 stomaches from pig. This one feed with organic food. Low level of GMO, medium level of GMO, high level of GMO. Please look the inflammation in the mucosa, and also, I don't know, maybe it's amyloid, I don't know. This is what happens also in our stomach. Maybe if we look at our stomach, they are very similar to this. So food plays absolutely a big role in controlling the microbiome. Which is the passage, the logic cascade? Alteration of microbiome, we lose the capability to control inflammation. TNF-alpha, interleukin-1, interleukin-6 rise up, and they destroy the junctional systems between the epithelial cells in the gut mucosa monolayer. Tight junctions, gap junctions, desmosomes. They are very important to make the epithelial cells like a barrier and to ensure the immune tolerance. If you destroy these junctional systems, all the molecules, food or bacteria, can pass through, stimulating the basal lamina and triggering inflammatory processes. If you don't close these junctional systems, you will reiterate continuously the inflammatory triggers. How can we do? Okay, we have always to protect the homeostasis of the gut microbiome. And I recommend you to act on this aspect, this low-dose medication named Ubioflor. Ubioflor contains several substances with anti-fermentation and anti-putrefaction action. It detoxify the gut, and also stimulate the immune system against the pathogens, especially Escherichia coli, Proteus, and Candida. It's really very, very interesting, because this way you reestablish with this drug the homeostasis in the microbiome. In every case of dysbiosis, think of Ubioflor. The directions are always the same, 20 drops twice a day. This is an interesting way to control microbiome. But also think of this food supplement named Colostrum. Colostrum is not a drug, it's a dietary supplement, and is based on bovine colostrum and noni juice. Is a Polynesian plant, also called Morinda citrifolia, with a very strong immune stimulating activity. The concept I want to transfer to you is that the combination of Ubioflor and Colostrum introduce a new concept that is neither kill bacteria like antibiotics, nor insert bacteria, probiotics to everybody, but select the microbiome. Select the good bacteria instead of the bad bacteria. You can reach these results in all the forms of dysbiosis, the typical sign of abdominal bloating that every patient refers to you, with the association of Ubioflor 20 drops twice a day for 2-3 months, and Colostrum It's very easy to use colostrum only because it's this one. They are oral-soluble sachet that you put under the tongue, one sachet a day for 2-3 months. In this way, you are rebalancing the microbiome. And since the microbiome is a controller of inflammatory processes at the level of the gut mucosa, you are preserving the histology of the gut mucosa. This is the composition, all the substances we have in the colostrum, in bovine colostrum. You know that the colostrum is the first milk, no? Mammal species is called the first vaccination. So rich of immune globulins. So rich in lactoferrin. And lactoferrin is an amazing protein, able to remove the iron from the bacteria. Bacteria need irons for their metabolism. So you kill the bacteria, the bad bacteria, the pathogens, removing the iron. And we perform a preclinical study in vitro, measuring the effect of colostrum noni on epithelial cells turnover and in controlling inflammatory processes at that level. Please look, with the colostrum noni, you increase especially the physiological production of an interleukin, that is interleukin 8, that is mainly involved in chemiotaxis of neutrophils. So you recruit neutrophil in the gut. Neutrophil are acting against the pathogen bacteria. So this is the action mechanism in selecting the microbiome through colostrum. I recommend, according to our experience, the combination in this biosis, colostrum noni plus Ubioflor. Can I have the new papers? Because I think I finish all of them.
Can I ask you, are you?
No, just the papers, please, just the paper.
Sorry.
Ah, okay, please.
Yeah, sorry. So, like, it's kind of amazing to, as a nutritionist, I'm speaking. You're telling me really that those two products can be used for all kinds of dysbiosis. You don't have to know the balance, because we often do stool tests to look for the balance. Okay.
Yes, for the most part, and consider that 70% in the 70% of cases involve Escherichia coli, very often Candida. So especially when you have that hyper-expression, Ubioflor and the colostrum work very well. But between the two products, which is specific is Ubioflor. Colostrum, since it increases interleukin 8, that means it increases the neutrophils, is quite specific. So I can tell you that it's not completely true that you can use in every type of dysbiosis, but in the most part, yes.
Okay. Okay. Secondly, in the field of colostrum, like one of the big deals that you'll find is that the way it's produced and when it's collected is really important. Yeah. First 6 hours and low temperature process.
Okay. The characteristic is dry freeze from selected cows, so it's absolutely the best possibility you have. I'm not a technician in the production, so I don't have all the information, okay. But what is important for me are the results in preclinical studies. And please, please remember that colostrum not only work on the selection of the microbiota, but also, do you remember the junctional systems that they were, okay, reestablishing the integrity of the junctional system. I'm going to show you the results about that, and this is crucial. I mean, colostrum is like a little surgeon that restores this cut in our mucosa.
You mean leaky gut? Is that
exactly the leaky gut syndrome? He is the product for the leaky gut syndrome, because And actually, I will show you the turnover of the epithelial cells induced by Colostrum noni is the only one increasing the turnover of the epithelial cells and also closing the tight junctions especially. It works especially on the tight junctions, and they are the most important because they are the most superficial on the intestinal lumen. So they really control the permeability. So in those forms of leaky gut syndrome, Colostrum noni is absolutely crucial. You will see that if you combine colostrum with interleukin 10 and anti-interleukin 1, you also decrease TNF alpha. Is the TNF alpha breaking the tight junctions? So this association is absolutely mandatory in leaky gut syndrome, but also in gluten sensitivity. And maybe you can consider also in celiac disease, not that you are curing the celiac disease, but you are ameliorating the absorption. Absolutely yes, the word is leaky gut syndrome.
You don't speak about avoiding the food triggers at all, the intolerance?
No. It's always better to avoid, especially in the first part of the therapy, the intolerant food. But you cannot leave your patients always without that food. So first remove the trigger, restore the immune response, and then the patient will be more able to answer in the right way to that food. But for sure, first of all, remove the trigger. Yeah, I agree. Okay, so what to do on the microbiota, eubioflora and Colostrum noni. Good, but when a patient comes to your office, already has the leaky gut syndrome, or in any way he already has a inflammation in the gut mucosa. So protect the integrity of the mucosal layer of the gut, And in this case, I want to show you this medication, very interesting, named GUNA bowel. Look the message. Always protect the integrity of the mucosal layer of the gut. Bowel, why bowel? Okay, especially for the presence of vitamin D3. We are speaking about epithelium, and it's absolutely important, the vitamin D. Maybe I have some slides about that. Vitamin D deficiency is a critical factor in the pathology of a variety of cancer as well as inflammatory bowel diseases, bacterial infection, autoimmune diseases, diabetes, osteoarthritis, periodontal disease, skin disorders, and more. And we know why is important vitamin D, that you can also use not only because of in GUNA bowel, but you can also use vitamin D3, not just vitamin D3, because vitamin D3 is captured by vitamin D receptor and is translocated inside of the nucleus to produce some proteins that are named zona occludens 1, occludin, claudin 1, claudin 2, claudin 12, that are the proteins of the tight junctions. So, using GUNA bowel, because of the vitamin D, you are stimulating the epithelial cells to produce the proteins of the tight junctions. So you are helping the gut mucosa to find again by itself its integrity. Bowel, so we can write here, GUNA bowel, it's really interesting by that point of view. But you can also think, you will decide what to do, Colostrum noni to work on the same aspect, that is, how to restore the integrity, because Colostrum noni restores the integrity of the intestinal mucosa because of the presence of lactoferrin, once again, and also, my friend, look, into the colostrum you have insulin growth factor. the active metabolite of GH. An epidermal growth factor for every epithelium. Fibroblast growth factor, transforming growth factors. Do you remember that we spoke about that in terms of cicatrization? So really, colostrum is so rich of growth factors. It contains also antioxidant vitamins. It works such as vitamin D in GUNA bowel, restoring the integrity of the tight junctions. This is the mechanism, but what is important is the result. Look, the rate of turnover induced by colostrum in comparison with starvation cells, the negative control, or just colostrum. Our colostrum is a combination of bovine colostrum and Morinda citrifolia. Please look the turnover. I mean, if you have a colonoscopy, not colonoscopy in English, anyway, if you had the possibility to look inside, you would observe a mucosa that was this way and now is this way. So really, it's amazing product. It's amazing product. So, if you want to select the right microbiome, ubioflora and or colostrum. If you want to act on the integrity, GUNA bowel and or colostrum. In this way, really, you are taking care of the health of the gut mucosa. Really beautiful products. We have several, you see, several dietary supplements, but if you ask me, hey Alessandro, which one would you save by a fire? Colostrum noni for sure. Colostrum noni is really amazing. And it's unbelievable how under colostrum noni we change our mood. Because the gut is a PNEI microcosm. 90% of serotonin is produced there. For instance, in your patients with Alzheimer's, let's go treating the gut. It's, really, they change, they change. Okay, conclusions. Colostrum noni restores the correct composition of the intestinal microbiota and the physiological turnover of the epithelial cells. In IBDs, especially in Crohn's disease, you have this autoimmune matrix. So, besides the microbiota, besides the gut mucosa, you have also to act on the immune system alteration. This is the picture of the immune system of your patients, for instance, with Crohn's disease. Th17, you remember, the subset involving every autoimmune disease. And Th1 are overexpressed. And, unfortunately, these patients have a dramatic, tragic overexpression of TNF-alpha. Is TNF-alpha that breaks the tight junctions. So, if you don't stop the production of TNF-alpha, you will always have something pushing the destroy of tight junctions. Why that patient is producing so much TNF-alpha? First of all, because unluckily for him, he has a Th1, Th17 overexpression, but also he has a disruption in the microbiota. So you can see how to combine all the products in this type of patients. TNF-alpha overexpressed. So what we did, we treat these patients with a combination of anti-interleukin-1 and interleukin-10. These results were published in 2013 in Gastroenterology Research magazine. And look the results, they are amazing. TNF alpha in healthy subject, TNF alpha in Crohn's disease, TNF alpha after treatment with anti-TNF alpha, Western conventional medicine. Great results, but side effects, and also 17,000 euros per year. 4 is TNF alpha after treatment with GUNA anti-interleukin 1 plus GUNA interleukin 10. I mean, we discovered for serendipity that the association GUNA anti-interleukin 1 plus interleukin 10, they work such as an anti-TNF alpha. If you don't S.P.A, you remember this morning the water, biological water, the low dose of anti-interleukin 1 and interleukin 10 don't work. And since pictures speak better than words, look at these pictures taken with immune fluorescence technique. This is a gut crypt. Okay, look. In blue is the connective tissue of the basal lamina. In red are the epithelial cells. This is a crown. The epithelial cells that instead of to be on the surface of the basal lamina are disaggregated. Why? Because TNF alpha broke the tight junctions and now they are here. Look after treatment with anti-interleukin 1 plus interleukin 10, the epithelial cells are perfectly, again, in the epithelial monolayer of the gut mucosa. That's absolutely amazing because we are working with low-cost, no side effect medications in the same way and with the same results of infliximab. So, to wrap up what we are doing, I think that in IBDs, but I can also say in IBS, we can work with ubioflor and or colostrum to reestablish the microbiota homeostasis. GUNA bowel and or colostrum to reestablish the integrity of the gut mucosa, and GUNA interleukin 10 plus GUNA anti-interleukin 1 to manage the chronic inflammatory processes. If you don't want, question for you, to work with the single GUNA interleukin 10 plus GUNA anti-interleukin 1, which medications you can think of that contains both GUNA anti-interleukin 1 and interleukin 10? Flav. I mean, hour after hour, they become familiar concepts. But this is really interesting. And look that, I don't know, but for me, over 50% of the population has disruption of microbiota, injuries in the gut mucosa. So it's a nice proposal, this one. How long? 4 to 6 months. I mean, you need time to restore the integrity. But it's really very interesting. We are working so much on that aspect.
Did you, out of interest, did you do any dietary counselling on these same people in the trials? Did you take out trigger foods?
Excuse me, speak slowly.
Yeah, sorry.
Because at 5 o'clock.
Did you remove food intolerances? I'm just curious in these trials.
Okay. In the trials, since it was very individual, you have to act for all the subjects in the same way.
Yeah.
In your practice, I think that if you don't remove the food intolerance, you have less results. Okay. So absolutely agree with you. First of all, test your patient to understand if he has food intolerance.
I guess my question was coming from 4 to 6 months. That's in people that haven't changed their diet.
No,
Yeah.
in the study, no.
Yeah. Okay.
Okay.
Cool.
But in the practice, yes.
Yeah.
Okay, this is the same, but it's more complicated.